Hoeflinger. I'm a neurosurgeon in Toledo, Ohio. I'm here with Kevin, my son, and I think Dr. London just joined us. He's already got hearts flowing by him. Nice.
Hey, Brian. Hey, Kevin. How are you guys? I'm Jeremy London. I'm a cardiac surgeon in Savannah, Georgia. I've been practicing for right at 25 years, and I'm super excited to do our second live together today, Brian. I hope that you've been having a great weekend. And
Yeah, it goes by so freaking quick. I mean, like it was just Friday. Now it's already time to go back to surgery tomorrow. When did you finish your residency, by the way? What year?
I finished in 2000.
Okay, I finished in '99. So I'm the more experienced one on this live.
You're definitely you're older. You're older.
No.
Yes.
I don't have any gray. I have no gray, so buddy. So it's.
I put this in here so people trust me. Yes.
Okay.
Yes.
But anyways, yeah. So we're gonna have a good time tonight. We have some questions that Dr. Lund and myself do not know the questions. Kevin's going to be the moderator. He's going to give us some questions. We're going to try to take some live questions tonight. We appreciate everybody being here. I saw somebody already from Belgium, from Ireland, from all over the place, Las Vegas.
Yeah.
All right.
Wow.
So, how about we start with where you guys both at right now? Just so.
What do you mean we're at?
We're in Toledo, Ohio.
We're in Toledo, Ohio. Yep.
And I'm in Savannah, Georgia, actually on Tybee Island in Savannah.
Nice.
What's it called? Tidy.
Tybee, Tybee, Tybee Island.
Oh, I've not heard of that.
Okay, so why don't we start with, we'll mix in some stuff. So they both came up with some questions for each other that they would be interested to hear from the other, and we'll mix in some of your guys' comments. I'll be looking at them as we go.
Hi from Germany.
But we got people from all over.
It's crazy all over the world. It's just unbelievable.
Thank you everyone for joining.
Melbourne, Australia.
But why don't we start out with, so this is a question from Dr. London to my dad. Name 2 ways that the practice of neurosurgery has changed since you started.
I mean, definitely probably the number one way that it has changed in my mind is computer-assisted surgery. So, when we were residents, it was really big on anatomy. Like I had to know if we're doing a biopsy in the brain, you really got to know where you are in the brain, know your depths and stuff. Now biopsies and brain tumor resections are done with stereotactic navigational assistance. So we can, make a plan on a computer ahead of time and then get our target where we want to go into the tumor. And then the computer will show you how deep to go and show you live when you're putting the needle or you're resecting a tumor where you are in the brain. So I think that's been a huge advancement and it continues to advance. Robotics has also come into play a little bit with spine surgery and minimally invasive surgery through tubes. But I think all that's good, but in my mind, you got to be careful. Like, you still got to know where you are in the brain. You got to know your depth. You can't believe a computer 100% because, computers can be wrong. And you can't ever forget to have common sense. These minimally invasive surgeries, they're great, but sometimes there's no replacement for having an open space where you can see what you're doing. And that's how you prevent injuries as well. So I think with every advancement, there has to be caution and you can't forget the basic anatomy, so.
Yeah, I agree. I totally agree with you. And I wonder how you'd respond to this. The way that I do a lot of minimally invasive surgery as well. And what I tell patients is that, occasionally when you start through a small incision, you actually have to make an open incision to do it, because the idea is that you can do an equivalent operation through a small incision. It's not just because you can make a sexy little incision and get it done. It has to be equivalent to the standard of care. And I think that's super important.
Well, sometimes you're limited to those little incisions. You're limited in in my world, how much you can do.
Sure.
And sometimes doing a little bit more and opening up the space more for a nerve helps so much for the future, less redo surgery. So it has its pros and cons.
Sure.
All right, so you guys have actually both done an Ironman. So one of my dad's questions was, what was the hardest part of the Ironman for you and why? And just as a little, for people who might not know what an Ironman is,
Kevin's done an Ironman, so
it's,
talk about it.
It's a triathlon. So it's swimming, biking, and running. It's a 2.4 mile swim, a 112-mile bike, and a 26.2-mile run. So what was the hardest part for you?
The hardest part for me was the bike because it was the Ironman I did was in Arizona, and it was an out and back course in the desert, and the headwind going out was tremendous,
Yeah.
and it just beat me down, and the temperature was probably 7 or 8 degrees hotter than it normally was supposed to be that time of year. So then by the time I got to the run, I was really, really, really beaten up, and I can't say that I had an impressive time by any stretch of the imagination, but I did finish. How about for you? What was the toughest part?
Definitely, it was. It was very hot that day. It was like upper 80s, lower 90s, and I think for me the hardest part was definitely mentally the end of the run because, my back hurt getting off the bike. I told Cindy, she was there when I got off the bike. I said, I can't do this, Cindy. There's no way I can run a marathon. But I remember about 4 miles before I finished, or 3 miles, I was so close to quitting, and that's where you have to really dig deep. But it sounds so, stupid, but you have to really say, why? I was just thinking, why am I here doing this? I can't give up now. I mean, I saw people off the side of the road vomiting and crying, and I don't know, something just kicks in, and those were almost my three best last miles time wise. But it was the hardest part was pulling myself together mentally when I thought I was going to give
Yeah,
up.
those last couple of miles are just straight pain management. I
Yeah,
mean, that's really all it was for me. However, that's impressive. That's super impressive. But it was a great experience
yeah,
for
And
sure.
and the question I would have is that I think, people always say, like, I don't have time for this or I don't have time for that. And you guys obviously both had very busy schedules. How do you think because I think one of the hardest parts of honestly doing anything is a lot of people can do a marathon, a lot of people can do an Ironman. It's just ramping up. You train for so long.
yeah.
How did you guys both go about fitting that into your schedules, and how did you make time for something that was important for you guys to accomplish?
Go ahead, Jeremy.
Sure. So, I mean, it's tough. It's really almost like having a part-time job on top of your full-time
Mhm.
job because you're either recovering from a workout or you're preparing for a workout. And if you look at, I think, most training plans, and I don't know if this was your experience, at the height of the training plan, you're probably putting in somewhere around 16 to 18 hours of training at the height per week before you start to taper. Well, that's a lot of hours. It really is. And so I would wake up super, super early. I did a lot of stuff with a headlight on before the sun came up, whether it was running or riding. I trained indoors a fair amount just to try to get more hours. It was tough, but it's like anything else. It's something that you really want to do. You kind of maintain a level of persistence to get you there.
Yeah. Um, Yeah, it's just true. It's just like whatever time it was that I got out, no matter if it was, 5 o'clock or 8 o'clock at night, I came home and did whatever I had to do or get up early like you. It's just, you got to do it. You can't come home and make an excuse. That was the main thing. And you're so glad when you do it, but it's such a commitment.
Yeah.
Um, Somebody asked, they said to us, they said, why do you want to do an Ironman? It's an interesting question. Why did you want to do it?
Wow. I just started doing triathlons, not with the intention necessarily of doing an Ironman, but as the distances got longer and I got more comfortable with them, I just kept setting my sights kind of higher and higher and higher that I got to the point where I was like, well, can I do
Yeah.
this? And so I just put myself to the test.
Yeah.
Yeah. So yeah, anyone watching this too, give it a like if you enjoy this stuff. If you want to see more, and give them both a follow. Someone also asked. We'll take a couple questions here. Is what does time with your family like for you two?
Go ahead,
Yeah.
Brian.
I mean, it's some days you get home earlier and you have a lot of time with your family, and other times you get home late and you have no time with your family, especially when you're on call and trauma call. So, but I think we do pretty good. I mean, my family's always been very nice about knowing that I'm not going to be home a lot and things like that. And when we do have time together, Kevin and I sometimes go golfing or we do our exercise stuff together. And Cindy and I, watch some TV shows together. We'll go for walks together. We'll go out to dinner and with some friends and have a nice evening. And Archie's lives with us now. Our grandson, my daughter Christy, has a 18-month-old, and so it's a lot of action around the house with Archie running around and getting into trouble. So it's brought new life into our family. So I think you can have a family life and have careers like ours. You just have to, you have to be cognizant that, work isn't everything. For me, work isn't everything. I mean, I'm a neurosurgeon. When I'm there, I take care of people. I do my best for them, and I do what I think is right. But when I'm off, I like to spend time with my family and enjoy my life a little bit too, because you only get one life, right?
Yeah. I'm in a very similar situation. First of all, I think it's a lot better now than it was
Yeah.
in the beginning of the practice when you're really trying to
Yeah.
build your career. I think things are much better. I too have a very, very supportive family. We do a lot together. My wife and I do a lot together. We share a lot of the same interests. That makes it really easy. I always kind of functioned on the motto as far as my kids were concerned. They rarely remember when you were there for the sporting events and things, but they always remember when you're not.
Yeah.
You can miss just that one game, and every time they're going to remember. You can be at every other game, but they're going to know that you weren't at
Yeah.
that one game. But you do the best you can, and I think that they know that I always do.
Absolutely. I think too, with a lot of it, is being his son is,
Yeah, Kevin's
I
lived
think,
through it. So
I think a lot of people, I think a lot of it is other people think you understand that, but it is, you understand, especially as you get older, you start to realize more, maybe like when you're like, in third grade, not as much, but as you get into high school and stuff, you understand what you guys are doing is very
Sure.
important, and it serves a great purpose. Um, there's another question I thought was a good one here is it true it's best to have surgery in the mornings instead of evening? Surgeons are supposedly more alert. Do you guys have an opinion on that?
gotcha. It's a tough one.
Yeah, I don't think that that's necessarily true. I think that usually our schedules are set out in a way that we individualize those, where we make sure we're not overloading ourselves. Obviously, if an emergency or something like that comes in, you deal with what you have to deal with. But I don't think that that's necessarily the case. Not for me.
Yeah, and also like I think my schedule put the more difficult ones in the morning, but even that, every surgery you're focused. It's not like I'm tired at the end of the day and I'm not focused. I mean, when you're in surgery and you're on a live person and you're in charge of their life and around their nerves and their brain and their heart, you're focused. Your adrenaline's up and you're very attentive. So it's not like you get tired at the end of the day and you can't do your job. I mean, every surgery we're the same. I mean, it's the same intensity, the same adrenaline, I think.
Yeah, I agree.
It can be the middle of the night and it's the same intensity, right? It's not like you're asleep.
Absolutely.
Yeah. So this is another question from Dr. London to my dad. It's name two advances in technology that have significantly improved the care of your patients.
The care of my patients. Um, I think, ICP monitoring for head injuries has continued to progress with fiber optics and how um, the accuracy of the monitoring, and also the tubes you put into people's brains to drain fluid. They have, antibacterials on them. So that's been an advancement. Um, I don't know. As far as patient care, that's a tough one. I may have to.
You think, what about medical records? What about or
I
maybe
mean,
you guys both do
I hate medical
what
records.
about super like minimally invasive stuff? I feel like that's always
But
like
that's
the
kind
key
of
word.
that's kind of the same question as what advancements. I mean,
Yeah,
I think navigational surgery, computer assisted surgery, has made it safer for patients for sure. But that's we discussed that already. Why? What do you think, Jeremy? What?
For me personally,
Yeah.
yeah, I think that two things. I think as far as how the standard operation has gotten better, um, the anesthetics have gotten much better than they were 15, 20
Yeah.
years ago. We're not leaving patients with the breathing tube nearly as long. We're getting them up, immobilizing them, getting them home. We now use wires and plating on the sternum, much like you use compression and fixation of bone. We learned that from neurosurgeons and orthopedists about how to close the bone better, and that's been a huge advancement over the last 10 years. And I think for us, the shift towards a lot of endovascular procedures now has really kind of shifted how we take care of particularly valvular disease with valve implants that go in through the groin and balloon expand a valve in that space and avoid a big operation entirely. I think those kinds of things have been, huge. I would imagine for aneurysms
Yeah,
with coiling of aneurysms and
I
things of that
say the
nature.
majority of brain aneurysms and strokes are treated endovascularly now. So it's not even sometimes a neurosurgeon that's doing that. It's a radiologist who specializes. So endovascular means treating something through the blood vessel. So they'll put a catheter or a wire through the groin and pass it up into the brain, and then they can treat different types of disorders in the brain that way. So that's been an advancement. That's almost shifted to a different specialty,
Interesting.
for us.
And this is a good question in here is do you guys have PAs assisting you in surgery? I'm hoping to get into PA school next summer.
I mean, I have for 20 years, I've had a PA. Jenny's my physician's assistant right now, Jenny Fender, and she's been with me for 8 years and invaluable. I mean, she's like a surgeon in there. She just knows the anatomy. She knows just how to assist me. She's great with the patients. Patients love her. When we're in office, she sees patients also. It's like having my equivalent there. And so it really helps me and my patients. Do you have a PA?
Yeah, my first assistant is actually a nurse practitioner, and we've been working together for over 20 years. And I can unequivocally say that I could not practice at the level that I practice at without her input and all of her support. There is no way. And, to find somebody, number one, who's that level of support, but also someone who can interact with patients and their families representing you at the same level that you would do that in person, it's absolutely invaluable. I think it's such an important part of medicine as we move forward that I think it's really overlooked, the importance of extenders.
Well, and also I think it's nice having we see a patient in the office and she'll present it to me or I'll talk about my patients with her, but it's getting another opinion too, right? I mean, she's very smart. She knows exactly what to look for. She knows how to read all the film. So it's getting two people looking at, you're getting two opinions at the same time. And it's invaluable.
Yeah, and when you get into clinical situations where you're questioning sometimes what to do, they're always very quick to remind you, well, this is what you do every time.
Yeah.
So think about your decision. And it's helpful to have that, checks and balances as you move forward, because you get very much caught up in the mix sometimes. So I think it's a very important component of my practice for sure.
And this would be a question for me, but I think this is like an important part. It's not fully a question, but just kind of hearing your guys' thoughts of, I think a lot of people, usually think of a surgeon or something else and they think, okay, this person's just performing surgery on me. But talking about PAs, there's just a whole surgical team. There's so many people that go into having a successful surgery. Like, I don't know for you exactly, Dr. London, but how many people are in the room? There's usually 5+ people. And I don't think
he probably has more people.
But I think that's like something that a lot of people might not know about unless they watch maybe a medical show. That there's a lot of people that go into a successful outcome.
Well, because there can be your physician's assistant, then there can be another assistant. There's usually another assistant who helps hand you the instruments during my surgeries. And then there's the anesthesiologist, usually a CNRA is with the anesthesiologist. Then there's usually 1 or 2 circulators. There could be a rep in the room who helps you with the implantation equipment you're going to put in people's bodies. If you're doing monitoring of any sort, then there's monitoring people in there. So yeah, it takes a whole team to perform these things, these surgeries successfully, to give people these great outcomes they get,
Yeah, I mean, it's the same. We usually have between 8 and 10 people in the room to do one heart operation. And, the reality is none of these things happen in a vacuum either, including the operating room. I mean, the successful process starts preoperatively with our cardiologist and how phenomenal they are with, referring them for appropriate procedures, and then us performing that procedure, and then our nurses in our, coronary care unit, they care for them afterwards, and then on our step down units. All of those pieces are absolutely critical to having the outcomes that we have here.
Well, it's all the behind the scenes. Like, think about people just to get our trays ready, that we have the right instruments of surgery. Those have to be put together by a whole team of people,
Exactly.
sterilized, There's so many things that the rooms have to be cleaned, you know, in between cases, and there's just a whole, you know, set of people who help do all that. That's just totally behind the scenes.
Absolutely.
Yeah, someone said, thank you for saying that. I'm a scrub tech, been one for over 20 years, and mostly serve as a first assist. But yeah, just like you guys are saying, it's like in anything. It's easy to see like the front person and forget about all, everyone's critical to the success of,
Yeah.
successful things, just like in any company or surgery or anything else. Um, but yeah, if you guys are enjoying this, we met Dr. London. We first talked to him a couple months ago, and he actually has a son. I'm 26. His son's also 26, and so we started talking to them. If you guys like this stuff, let us know in the comments. Drop a like on the live, share it with people. We're gonna try to start doing more of these. Um, we're gonna go to the next question. This one's a little heavy. This is one of my dad's questions to you, Dr. London.
Okay.
But how do you approach families when you think or know there is no hope?
I think that I'm just as straightforward and honest with them as I can possibly be. And usually I predicate that on, I'm going to take care of you and your family members as if you were my own. And I offer, exactly what I feel like the risks and benefits of an operation versus not operation are, road A versus road B, and then give them my opinion and then help support them through that process. If there's absolutely no hope, if you're talking about withdrawal of care in that situation, I think that for me personally, it has to be a devastating, unrecoverable situation or recoverable to a point where there's no quality of life. And then typically, my conversation usually revolves around, what would be the most respectful thing based on what this particular patient's wishes would be, and what would you want for them given this circumstance?
Yeah. I think because this happens a lot. There's a lot of people that there's just no hope for, and I'm just like you. I'll just tell them, I think I need to be honest with you so you guys can make good decisions about your family members. So you need to know everything. But I think our job, what I see it as, is really trying to make them feel comfortable with something that needs to be done. If there's absolutely no hope and the person's brain dead or has an irreversible injury, it's about, and I just had this other day on a trauma call, she was blaming herself, like, what did I miss? Should I have done this? Should I have done that? And I said, stop. You didn't miss anything. There's nothing you could have done. It's, bad things happen to good people all the time, and you can't feel guilty about that at all because it wasn't your fault. And the best thing you can do for him, he's at peace now, is let him go. But I think that's what you have to, they look up to us, and I think that just to try to give them peace of mind, because it'll eat at them forever if they think they missed something.
Yeah, and I think that it's like most things in life, creating reasonable and appropriate
Right.
expectations given
Exactly.
the circumstances. Patients and their families appreciate that.
Yeah.
I really think they do, and that's usually my goal.
Yeah.
Yeah, and this would be a question for you, Dad, but do you think your personal experiences in life with your brother and your mom and also your dad to an extent, do you think that's helped shape what you would recommend to other people and what you want for yourself, probably?
I mean, it has, and you have to be careful because I've had a bunch of tragedies in my life, and so I'll bring up my mom. My mom had metastatic brain cancer, and I'll bring up that she only lived 3 months, and she had 2 brain surgeries and radiation and chemotherapy, and all her hair fell out. Or my dad, when he was in the emergency department, his heart stopped. I started doing chest compressions, and then I'm thinking, what am I doing? He would never want this, and I just stopped. And the team there wanted to keep doing compressions. I said, stop. It's my dad. Let him go. But I think all that has shaped me to when I talk to patients, I tell them about personal experiences, and I say, so it's just something to consider. I mean, it can go both ways. You might create somebody like my brother who had a bad head injury and had from a car accident, and he lived for 40 years afterwards in a nursing home, could never walk or talk. I mean, that's not any kind of quality of life. So I do think personal experiences can shape the way that you talk to patients and interact. And I think the patients, it brings you down to their level. Like, people realize that I'm a real person. Like, I've been through some of this, and I think they can trust me. They seem to trust me a little bit more because I've been there. I mean, I've been there, and I've had to make these decisions and see it.
Yeah, there's definitely a level of validation, I think, when you bring that to the table when you're having those conversations with patients.
Yeah. This one's for you, Dr. London. Someone said, "Is cardiovascular surgery still a good career in the future?"
Absolutely. Absolutely. I know there's been lots of questions over the last few months. Is cardiac surgery a dying specialty? Nothing could be further from the
Wait,
truth. I mean,
where'd you hear this? I've never heard this.
yeah, well, I think that with the amount of patients that get stented, there's this
Oh,
impression that there's less heart surgery as a
yeah.
result of it. And that's just not the case. I mean, when we look, as I mentioned, endovascular surgery earlier, that's an entire burgeoning field that, it's been around for the last 10 or 15 years, but now the level of traction it has, it's just becoming expansive. The development of minimally invasive approaches to do all of these standard operations then changes the indications a lot of times for these procedures, because now the surgery is much easier for these patients to get over and has less mortality risk in many cases as well.
Yeah.
Yeah. All right. So back to another question. I'm just trying to mix these up, but I think this is a funny one because me and my dad were coming up with some stuff. So I would love to hear your opinion on this too. Does your wife ever get annoyed with you and or your son when you guys are doing social media or like filming any of these videos and stuff?
Um, no, she doesn't. She loves it, and she's incredibly supportive. She likes to know like what we're doing, and what's our next topic, and how are we doing it. I think she maybe gets annoyed at me when I'm working on it, and I'm so focused that I'm not
Yeah.
fully engaged in the conversation.
Yeah.
But the actual process, she's super supportive of, which I really appreciate.
Yeah. Cindy gets a little annoyed with us, I think, because, we're both working all day and then we'll come home and start doing this stuff. It's just, God, you guys, can you just.
Yeah, no, it's I always say, yeah, she's obviously super supportive. And actually, my mom,
Oh,
we
yeah,
finally convinced her to get out. We've been telling her for a while now.
I saw her post.
Yeah, no,
Yeah.
she just gets annoyed by some people because there's just some haters online. There's just some people
Uh,
that just are very annoying online.
So for you guys out there who are listening, so my wife's a forensic pathologist. She's an MD, PhD, and she's been in some of my videos, and people really like her, and she's very engaging. So she finally agreed to do some social media. So we'll see what happens. But she's already got since 7 o'clock last night, she's got 6,000 followers on Instagram.
But people love, I was telling you,
Yeah.
people love like the true crime, all of that stuff. There'll be 99 positive comments. She sees that one mean comment people will say, and then she gets annoyed by it. I'm like, it's also, I started telling my mom to click on their profile. It's always people with 0 posts, 0 followers. But yeah, so my mom will get annoyed at me. My dad, like, she'll be, we're trying to film a video or something. We've got some ideas we're always texting about of what would be cool educational stuff. And sometimes she's making dinner or something. Because also, I'm assuming you do all the time too. Like you film videos at home as well as, at the office and stuff. And it's when you're at home, it's hard to separate stuff. So it is fun.
I think it's a shame too, because I think I did post a long time ago on this, but it's how many people don't do social media because they're afraid of the comments, of the negativity. And it's like, that's like stifling people. If you got something good to say and teach people, it's such a shame that you're afraid to do it because of the negative comments. And you probably get them, Jeremy. I've gotten lots of negative comments, and I just get them. I don't know if they're true or not, or if the person just has a bad life and just is a negative person and wants to, but it hasn't stopped me at all. I mean, it's one of these things that you have to take the good with the bad. But if you believe in what you're doing, you think you're putting out good content, the negative content, negative comments should not stop you from doing that.
Yeah, I mean, it's like Kobe Bryant said, if you're not, if you don't have anybody hating, you're not doing anything important. And so I think that's kind of our motto. Now, Max doesn't let me look at any of the comments. He doesn't let me go down the hating rabbit hole because he's worried it's going to change the nature of my content. And he just wants me to really stay focused. And he always says, just put stuff out that you're proud of, and then don't worry about anything else. And I think that's really been very constructive advice as I've moved through this. I think that you're right. I think there's two reasons that people don't want to jump on the social media train. One is they're scared of being criticized. And number two is just starting, just getting that first video or a couple of videos out there and realizing, okay, I think I can do this. It's really hard. That first one is probably the most difficult video. At least it was for
Well, because
me.
you're worried what people are going to think of you,
Yeah,
and
yeah.
you don't have any acceptance or any support yet.
Well, I think it's also like not in a rude way, but you guys are both a little older. Like you guys didn't. We grew up, me and Max, obviously to a more of an extent, like with social media and like seeing it and stuff. So it's a little different versus when you guys are first doing it. It's a completely different world of like just telling my dad of like it is pretty insane when you can put something out and like 100,000 people or more can see it.
Mm-hmm.
And I don't know, there's something which is pretty crazy. And I always think about it, no matter what you talk about, there's always going to be people that disagree. We'll put stuff out about my brother and just trying to be educational stuff about not drinking and driving. And there'll be people like, oh, you're a total buzzkill doctor. like you can never win on something. So
Sure.
it's, and I think we've talked about before too, is like, you don't have to try to make something that's going to potentially affect millions of people. It's like I'm a firm believer is that everyone has an opinion and a voice in this world. And it's like if you can reach one person that can positively impact them, then that has the ripple effect.
It's interesting. Have you thought about like when TikTok came here and was filming at our house, they said part of the reason they were intrigued is why so many young people are following somebody your age. I mean, that's what they said to me. That was part of the attraction. Same thing with you. All these young people are now following you, and you're old, really old.
Thank you. You're older.
Wow.
Yes. Yes.
He's exposing you.
But anyways, what do you think about that? I mean,
Yeah, I mean, I totally agree with Kevin too that, it's kind of two pronged. On the one hand, I really feel like this has given me an opportunity to be exponential in my ability to get in front of people and offer accessible, reasonable medical information to the masses, if you will, hopefully in a way that is easy to understand and it makes a difference in their lives. But as far as what really matters, it's like if I just get that one person that it really impacted, that's enough, and it's been more than that have communicated with us. And that's what really keeps me going and what I really enjoy about this.
and like anything in life, you'll never know how many people you've affected. I mean, we've learned that through my son's death. I mean, you just never know how many people you're affecting with these posts because you're not going to get that feedback. You could have saved somebody's life and you won't know it.
Mm-hmm.
Absolutely. So this was someone's question I thought was a good one because I don't know the answer to this, but this person said, I have serious diabetes. Can I still choose to be an organ donor?
Yeah, I mean, there are certain disease processes. I know that when the organ donation people go through and run all these tests, they're going to exclude some of the organs, but it just depends if your diabetes has affected your organs to the point that they can't use them. So that would really be it. I mean, the testing that goes on for organ donation takes 8 to 12 hours of pre-testing to really find out what the organ donor can donate. And so it's an extensive testing process. So they're pretty good at it. So it just depends how bad your diabetes is and what it's affected. Thoughts, Jeremy?
I agree. I mean, I think that process is very thorough. And the bottom line is there's not enough organs to go around. And so, unless I think it's wonderful, number one, that you're even considering being an organ donor. I think that's awesome. And I think that the diabetes should not stand in your way because the process will take care of deciding which, if any, organs are appropriate for donation.
But I think if it's just mild diabetes, I don't think you have.
I agree.
You're a full organ donor yet.
So this was a question from Dr. London. As your social media has evolved, what specific things have you done to grow in the space?
What have we grown in this space?
Or like done as you've grown maybe, or like what different things have you tried to do?
Yeah, I think, so when I didn't really know 2 years ago what TikTok was, and my kids kind of showed me what it was. And, I saw a lot of singing and dancing. I said, Kevin, I'm not doing this. That's not what I'm, and we've not done any singing and dance. Not that there's anything wrong with this, it's not me. But we started out trying to educate people. And I think that's where we've grown is what different walks of life that we can affect, whether it's organ donation, American Heart Association, drinking and driving. We look for purposes that we can make a difference in. And I think that's where we're expanding, is right?
I would say a couple other things. Like
Okay.
when I started, I think a huge thing about social media, like the other thing we were talking about, and obviously we're on social media, so I think these are cool things to talk about. But I think the biggest thing is always authenticity, like you just said, of doing what makes sense to you. Like you shouldn't try to be something you're not. And because a couple of the other things we've done as we started growing, like doing stuff on other platforms, podcasts where we could, because TikTok inherently and then Instagram and some of these other things, inherently the things that go the biggest are the short form videos. But then you want people who are more interested. We've started podcasts and a newsletter. I know, Dr. London, you have a newsletter as well, because obviously you guys are both, I've read some of your news. You guys are both very good writers. I mean, that's something people have always said about my dad as well. And same with the podcast, is where you can then dive deeper into topics where say a video gets millions of views on short form. You're like, okay, people are interested in this. I want to now dive deeper into it where I can discuss it more for the people that want to, listen to a 20-minute podcast or read a newsletter.
Yeah, I mean, I think that's what I expected you to answer, but I'd like to make one comment about authenticity, because I don't know if you remember, Brian, in our first conversation when I asked you, like, if you could give me one piece of advice while I was just kind of getting started, you said remain humble. That was your one piece of advice, and the way that I feel like Max and I have actuated that is, that my personality and our social media persona are in line. That our social media persona is accurately portrays who I am, and I think I think you're the same way. Um,
Well,
you
because
know,
so many people think, a heart surgeon, a brain surgeon, we're just arrogant SOBs who don't care about anything but money. Some people think that, but I mean, we're people too, and you're just a nice person, and you should express that to the world, and you have, So I mean, people can still be heart surgeons and be nice people and not arrogant. Not every heart surgeon is arrogant. Well, I mean,
This one ties in. This was one of my dad's questions, Dr. London,
sure.
but you've grown very. It's funny. We talked to you 2 months ago, and you were kind of blown up on TikTok, but now I was talking to Max about that. You guys have grown really quick on the other platforms, but you've grown so quickly on social media, and it's pretty similar to us, where it's probably a completely new world to you that could even be possible. Have you found it all intimidating, or?
Yeah, I mean, I think it is humbling. I think it is absolutely overwhelming, and I am so incredibly appreciative of all the support. And I'm really still trying to kind of wrap my head around all of this, because I don't, unlike you and Max, Kevin, I didn't grow up in this space, and so I don't really understand sometimes what the implications of the slope of this curve actually is and what these numbers are. But I do realize how much it means, and I'm really grateful for all the support. I really am.
No,
so
you
I think,
deserve. Oh, sorry, but you deserve it. It's like I was telling my mom. It's like you guys. This wasn't around when you were younger, but I was just telling my mom. She's like, "Why did so many people follow me already, or this or that?" I'm like, "You've accrued so many things where you guys have worked so hard your entire life. Where you didn't start this when you were, say, 25. You guys have accrued these credentials and experience and wisdom. So it's like it's just now coming to fruition. Is kind of how I think about it, and so it's not like you're growing really fast. You've put in 40 years plus of work to get you to that point. But
so somebody had asked, so we talk about behind the scenes. So somebody had asked, are Kevin and Max doctors or in healthcare industry?
They're smarter than doctors.
Yeah.
no, no.
Well, they're
I'm
social media managers too.
yeah,
So
I'm in. So I went to the Ohio State University. I'm in business, and then I do all this with my dad, obviously, and then I'll let you say for
Sure.
Max.
Max graduated from Wake Forest, and he is really a social media marketing expert. He has been doing this since he was in high school, has really built some phenomenal platforms. He has a significant amount of experience in the medical space, and he's really been pushing me for years to try to do this. And it really wasn't until we saw Brian and Kevin's work that he was able to convince me. He just got married recently, and so he's not here anymore to monitor me closely, which I'm sure creates a great deal of anxiety for him. But I couldn't do this. I couldn't do this without
No,
it. I
yeah, and
mean,
I've talked
it's
about it.
there's
It
no.
is crazy like just I still can't get over the overlap because like me and Max are so similar, and you guys are so similar, and then the joint of the similarities. So it is pretty cool.
Yeah, I agree.
But this is another good one I thought because it's kind of towards both of you. But any food suggestions? I know this was in one of your newsletters recently, but any food suggestions in keeping your brain and heart healthy? So we'll let you go first, Dr. Linden.
Sure. You know, I feel like with dietary recommendations, keep it really simple. You know, you want to eat real food, whole foods, things that aren't processed. You know, you want to have an appropriate breakdown of protein, carbohydrates, and fats. And you know that really is the basis of nutritional support. You want to have a pretty good idea of what your basic needs are from a caloric standpoint, so that you're not overeating or undereating unless you're doing those things intentionally. But I think, you know, in general, if you maintain kind of that, you know, whole foods attitude, and you limit alcohol or remove alcohol, limit caffeine or remove caffeine. I think that, you know, those are basic guidelines. There's really not as much mystery surrounding this as has been created by the industry.
Yeah. Yeah, I mean, I don't have much to add. I mean, just it's all the stuff that we want, pop and all the sugar and pop and cereals in the morning and, pastries and desserts and all that kind of stuff. If you just knock that stuff out per week, you'll save so many calories. Exercise a little bit, and burn some calories, keep your body in shape. I mean, that's what you need to do. But I agree with you 100%. You put in one of your posts. I mean, nutrition is 80% of it. You can exercise all day, but if you eat 4,000 calories at a meal, you're gonna all that exercise is gone.
You can out eat any exercise you
Yeah.
do.
Well, it's crazy to think like you go out for a 30-minute run and it's like 300 calories or something like that. I mean, you eat a bagel, one bagel, and that bagel is your 30-minute run. It's crazy, isn't it?
Exactly.
Well, I think it's honestly just like with diet, just like, I mean, this is one bad thing about social media sometimes. There's so much advice about it. I think there's certain things like health, whether it's healthcare and specific medical things or food or like finance. These are big things, and people want to give very quick, generalized points, but they're so personalized. Like someone who's doing an Ironman, you can eat a shitload of carbs, and it's not going to affect someone in the same way.
Right.
So, like if you say all carbs are bad or all fats are bad, it's just such a blanket statement that's not going to work for a lot, like at least half the people, because it depends what you're doing.
I think that's a
Well,
great I think that's a great point. And I think the way that I usually couch that to people is that, you know, we all have a different instruction manual. Mine is different from y'all's, and it takes time to investigate that for yourself to figure out what that is, and what works for me may not work for you, and that's okay.
Yeah.
and I really
100%.
think everything in moderation. I mean, life's not all or nothing, black or white. I mean, there's always moderation, and it doesn't hurt to have a dessert once in a while or to,
Sure.
stuff like that.
That's why I think diets sometimes too. That's why I mean, I'll say this with so many different people is that it's so like people will say like, oh, I miss my diet, then they'll miss the next 7 days in a row. Like I don't know what this quote's from or who it's from at this point, but it's just like with any habit, it's just like don't miss 2 days in a row. Okay, you missed yesterday, you took it easy. Don't miss 2 days in a row. That you'll do way better on with going by that.
The one I like that Cindy's done so many diets. She's like a nutrition, honestly. She did a nutritionist course. I think she's certified now, but we've tried so many different diets over the years. But I like the one where we 6 days, and then on 7th day, 1 day a week, you can eat what you want, because it gives you something to look forward to. So I can bear through these 6 days because I know on Sunday I can have a cheeseburger if I want, or if I want to have a shake or something. You know what I'm saying? I think it's a great way to look at it.
Yeah, I mean, I think there's two things when it comes to diet. Number one is sustainability. You have to figure out what's going to work, and so like that kind of mindset, I think for a lot of people, they're like, okay, I can do that, and then you have to kind of think about your overall, you know, health. Am I getting, you know, am I eating nutrient dense food so that I'm not only getting the calories, fats, proteins, and carbohydrates, but am I getting all the minerals and vitamins that I require? And if you kind of can manage those two things, you pick something that's going to be sustainable. That's why I don't like the fad diets. You know, I think that, that you can lose a bunch of weight and you can potentially even feel better, but you can't do them forever.
Right.
I think that's
definitely
like with anything. I think because like I'm in finance, so I always think of it with money and other things. It's like or exercise. It's like sustainability beats intensity every time. It's like if you go run hard every day, like you're gonna burn out really quick. If you just run really easily or walk for 30 minutes a day, that sustainability, when you apply compounding, will just beat out anyone else. So you just want to stay in the game. So this is one of Dr. London's questions, but this is kind of a fun one, so we'll see your answer. If time travel was possible, would you go forward or back in time? Into what era?
Well, I already know my answer. You know what my answer would be.
Well,
It's a fun one, but it's not fun in this way. So should I take that out of the mix?
No, just
Be honest. Just be honest.
Well, my honest answer, it has to. I mean, if I could go back in time, I'd stop my son Brian from getting in the car and drunk driving to save his life. I mean, that was 11 years ago. So that's, even beyond my parents. My parents were older, and they're, old, but Brian didn't need to die at age 18. So that's what I would do.
Sure.
But beyond that, beyond my son and changing that, I would. I don't know. I'd almost rather go to the past. Who knows what the future holds? I wouldn't want to pop into the future, and I wouldn't want to pop in the future and find out somewhere I don't want to be. I'd almost rather go to the past, a period of time that I thought was a really neat period of time, and live in that time.
What period of time do you think?
Yeah,
because I like reading about like historical stuff.
I would probably do the industrial age, late 1800s or something, when things were really, like Henry Ford inventing the car. I'd like to get into that time frame where I could invent something that would help change the world, and figure out something out like that. I mean, that was the golden age of all these tycoons who really changed the world. They made a lot of money too, but that wouldn't be the point. Is to just help do something to make the world a better place, and you'd have that ability to do it.
A lot of people are saying back to the 80s. They both lived through the 80s, guys. Don't worry.
Yeah, the 80s don't interest me. Sorry. The music, I love the music, but so I listen to an OR, but yeah.
What about you, Dr. London?
So the industrial age would be my second choice.
Okay.
For me, I would go all the way back and be a Viking.
Wow.
100%.
Okay. Don't let your wife hear this.
Wait, have you ever
Holy
seen?
cow.
Have you ever seen Vikings on?
Oh yes.
Have you seen that? Yeah. Ragnar Lothbrok?
Oh yeah.
I just was rewatching that. I watched that back in high school. Podcast. But yeah, no, that's. Have you ever seen? What about Have you ever seen Midnight in Paris with Owen Wilson?
I have not.
That's actually like kind of about this concept about going back. They're like going back in time, and they're hanging out with like Hemingway and some other people. I don't know. It's with Owen Wilson, but you would probably like it if you like that concept.
So Jeremy, I got to read this question. So this is a guy. David. We were on his podcast. Really cool, funny guy, and his podcast is about grief, but he puts humor into it. It was really a good podcast. I loved it. So he said, my mother went into cardiac arrest, no pulse for 10 minutes or so, and only remember seeing my deceased dad, uncle, and her parents. Have you seen a lot of these stories, and what do you think? Is it real or not?
I have not seen a lot of them, but I have seen some. And, I think to say whether it's real or not is not for me really to even judge, but I think it's real to the person who went through it, 100%. And so that's enough for me to respect that experience for them. And, it certainly makes sense. I think if you try to intellectualize it, for sure, but I try just to maintain a very open mind with that. And but I have seen it several times over the years, very similar to that.
I think there's only two options. I mean, one option is that it's real and there is something more there, or the other option is we're all human. We have the same brains, the same electrical pulses, and maybe when the brain loses oxygen and blood flow, we all have the same chemical reaction that sparks this light that people see and all the things they see and have vivid dreams. So we'll never know, but there's only, really those two options the way I see it.
Yeah.
And you believe what you want to believe, that's all.
Exactly.
And shout out to David. If you guys, it's actually called Dead Talks Podcast. My dad did it with him, but it's a really cool thing because, grief is somewhat more of a taboo thing in our culture. So I think what he's doing is really cool. opening that up for the avenue for people that have been through that, to hearing other people's stories.
I
So
love that.
Check it
Yeah.
out.
check it out. David, I would say your last name Fuego or something, maybe, but I probably
It's
butchered
called
it.
Dead Talk Podcast.
Yeah, Dead Talks Podcast.
Good question.
And this was actually Dr. London's last question, and then we'll do some viewer Q&A to end it. It said, please respond to the following quote: "Surgery is an excuse for what we don't understand in medicine." So like surgery is an excuse for blank we don't understand in medicine. If that's how you intend, I'm not. Is that how you intend to ask the question?
Let me give you an example. When I was in training, the head of my program in general surgery used to say that surgery is only an excuse for what we don't truly understand in medicine. For instance, like peptic ulcer disease. We used to do a lot of gastrectomy and gastrectomies, and now we know it's bacteria, and you're treated with H2 blockers. And there's several examples like that, and I was wondering if there's things that are in that same realm in neurosurgery, if you've had that experience.
So are you saying like we're treating something surgically instead of trying to find the medical cause and treat the medical cause?
That over time, many times we realize that surgery is not the best answer, or maybe it's a minimally invasive approach.
100%. I mean, there are now certain tumors that you can do radiosurgery on, and kill the tumor that way. You don't ever have to open the skull, and you don't ever have to do surgery. I mean, definitely there's things like that, but there are, habits die hard, and there are surgeons who just believe that surgery is always the best route, no matter what. And there's other surgeons who feel like, if you can get somebody out of surgery and there's another way that's equivalent, that's the best way to do it. So I'm kind of that route a little bit. I think if we can do something non-surgical for somebody and give them a good outcome, why put them through surgery?
That's why I asked you the question.
Yeah,
that was the exact reason.
I think.
Yeah, same.
All right. No, sorry, I just didn't know the question. Thanks for clarifying. I was just.
That's good.
This is I don't. Is it positive? Is it possible? I think they mean to be a successful neurosurgeon with one normal functioning hand.
It'd be hard because I'm right-handed, but I operate a lot with my left hand because you have to be using both hands at the same time. If you've got heavy bleeding and you need to be dissecting something, you got to have the sucker in one hand, and you got to be dissecting with your other hand. So if you get in situations where there's bleeding and things like that, it can be tough using one hand. I guess if there were no bleeding, you could probably do surgery one hand, but it would be hard because I use both my hands every case.
Are you more talented than him?
Yeah, I think it's talent.
I was kidding.
But wait, do you use hands during heart surgery?
Is there a limit on how many surgeries you guys can have in a year? And then a follow-up question that I was thinking about from this is, do you know like the most cases you've ever done in a year when you were the busiest?
I know one.
Yeah, go ahead. Go ahead, Brian.
Mine was 550 in a year, which was insane for me. Those are major cases. They're not like,
But is there a limit on how many cases you can do?
No, there's not a limit. I mean, if you have no life and you want to be at the hospital all the time, I mean, you could do more cases. You could do 700 cases a year. I mean, but you're going to be there all the time. And I don't know. What do you say?
My number is almost identical to yours as far as the most cases. It's right around 550.
Yeah.
And it was crazy. Yeah. I mean, absolutely crazy. I think that there is a limit in what you can physically do in a day that's appropriate. And so, for me, it would be 3 major heart surgeries would be the maximum I would do in any one day, but I would not do that day after day after day. It would be.
Also, don't you find it like, I'll tell you, a hard case or a hard day of surgery, it's draining.
Yeah.
It's physically draining, but it's mentally draining because you're so focused and you have to concentrate sometimes so hard. And, cases can get difficult and it's draining. I mean, you have to know your limits. I mean, I think you and I are very much like that. We know our limits, when to stop, and enough is enough.
Yeah.
Because it's
for sure.
We'll just do like 1 or 2 more, but someone said, have you ever used the Da Vinci, this for you, Dr. London, have you ever used the Da Vinci robot for heart surgery?
So I personally have not. I made a decision to do the minimally invasive approaches for the valve surgery. That's primarily what it's used for. And the reason I did that is because I feel like I do the exact same operation through these incisions that I do through the big incision, where I felt like I was not only having to learn an entirely new technique, but I was also doing the operation slightly differently. And so for me, this made more sense. There are folks that are phenomenal with the robot, and most of those people are very focused as far as their practice with the robot. They don't necessarily do as many cases as I do a year, but let's say they do 150 cases with the robot exclusively, and they're very, very good at it. And if patients request the robot, we certainly have options, for folks to seek that opportunity.
Um, Going off this, I think this is, I mean, AI over the last like 2 years with OpenAI and everything. I think this is, a lot of people always wonder this stuff. What do you guys both think? So AI and robots, do you think it'll take over surgery, whether in the next 5 years, 50 years? What are you guys' thoughts on
I
that?
mean, it totally depends what surgery you're talking about. Because I know, probably like with you, I have to make decisions from moment to moment. And there is a gestalt, don't you think, a gut feeling? Like when you're in there, you have certain gut feelings. I don't know if AI is there yet to make those decisions. Yeah, mechanically and precisely, could they do the surgery? I mean, they're already doing it by doing the implants for the, the Neuralink, I mean, they're putting in the stuff into the brain through AI and robots. So they can be very precise, but they can't yet make the decisions that we make on a second-to-second basis during surgery.
Yeah, I think that AI is, as it stands right now, very functional and very useful from a protocolization standpoint. But one of the intensivists that I worked with, he's retired now. He used to say that the practice of medicine is knowing the protocols. The art of medicine is knowing when to apply them. And I think that that is where the disconnect is right now. And that's exactly what you're talking about. The blink response, like having that blink response and that ability to switch gears based on what's happening from an intuitive standpoint. Just because you know the protocols doesn't mean you have that ability. And so I think that leap is going to be significant. Do I think that AI will help us take better care of patients? Yes, I do. I do.
So I would have a follow-up question, two parts here. So do you think it could ever be that there's a neurosurgeon or a heart surgeon or any other surgeon looking over a robot that can do all this stuff, but they're like the executive decision maker, kind of just like someone who's coding, like in engineering, they code the robot, but the robot actually does the work. And do you think that would happen within our lifetime or your lifetime?
Go ahead, Brian. I'll let you answer it first.
I think I think it would be hard, if something happens, you need to make a quick move on something. I'm not sure you could describe. I mean, how do you describe to the robot exactly what you want them to do? I mean, that would be the hard part, I think.
I'm not forcing you. I'm saying for in your no in your opinion, no, I'm not. That's what I'm saying is in your opinion, it's probably not. We're still pretty far off from that.
I mean, I think what
someone.
has to happen is the robot has to have some human component to it. The robot has to have some link, like neural link, between the human thought, relaying those messages to the robot, and then I think the future will change. But that's a slippery slope, because it could be just like those movies with Arnold Schwarzenegger, honestly, because if the robots gain consciousness, because there has to be a human component to them, I think somehow for them to when they're in surgery, doing surgery, they have to be able to make decisions that we make, and right now that's more of a human gestalt thing. Mm-hmm. It's our training, it's our intuition, and when you bring that intuition to a robot, then I think you're going to have a self-conscious AI.
Sentient.
Yeah, and I think that's definitely going to happen. I think it's going to happen somewhere in the future. I just don't know when. Don't you?
I don't know. I'm not certain.
Okay. Well, it's not just in general. I think it's going to happen.
Yeah, I think it is too. I mean, even if you look at, and maybe it's going to happen the other way. Maybe it's going to happen this Neuralink pathway, where instead of the robot becoming humanized, we actually have instantaneous access to the information, which is also very frightening on a multitude of levels. But to me, that is like I can connect those dots a little easier than the humanization of the robot, if you will. But do I think that's going to happen in my lifetime? I would say probably not. But I mean,
Yeah.
That's no, it's just, I mean, because yeah, it's just like anything, like it's kind of log. It goes so fast where like all of a sudden we weren't anywhere, and then things have developed. It seems so fast in the last 5 years where AI is all the talk now. But that's in a really interesting way because I honestly hadn't thought about it that much or that way as much either. But that honestly does seem like the more likely way of
and
putting in.
we're already down that
Yeah.
path, not successfully so much, but I think that to me that's where we're gonna head.
Well,
I
I
mean,
think it's
that's
easier
total
probably
speculation.
to overcome that from like to get the humans to get that inserted versus the other way around because that's like the hurdle. Like even this AI that can do all this crazy stuff, like it can't solve something like a 5-year-old like logical reasoning, like easy things. It's like the captchas and other stuff. So there's a lot of things that it's funny how it works both ways.
But I think if you have, so as far as surgery goes, you have a computer that feeds information into your brain, so you have access to information. It's still not going to make you more accurate than what a computer or robot could do because we still have nerves. Our hands can shake. Our reflexes are slower. You know what I'm saying?
Sure,
So I mean,
sure.
a robot could be much more precise and quicker than what we can, but they don't have the information that we have in our brain. So it goes both ways. I don't know.
It sounds like your guys' jobs are safe. But yeah, if you guys enjoyed this live, we're definitely going to try to do more. Let us know in the comments if you're not following Dr. London or you're not following Dr. Hoeflinger, whoever you're here for. Give them both a follow.
Or Dr. Cindy now. Dr. Cindy.
Yeah,
Dr. Cindy.
My mom's on social media now too. Also, if you're interested in this stuff, like each week they both do a newsletter. They dive deeper on this. We have a podcast as well. We want to get Dr. London and his son on. We'd have some good conversations. But yeah, we want to do more stuff like this. It's very lighthearted. You guys are both very similar. You have very different experiences, but you guys are both very similar. I think it's much. I don't know what other people would think, but I think that people enjoy this live. It's easier to go back and forth versus just pulling stuff out.
But yeah, thanks for taking the time to hop on. I know you guys are all around the world. That's so awesome, and
That's
we add value to your hour here.
absolutely. We really appreciate it. It's amazing the amount of support that we've had.
Yeah, it is.
Yeah, but we hope you have a great rest of your night, Dr. London.
Yeah.
It's been great to get to know you. And we're